Hey there, welcome back to the channel. If you're new here, I'm Kim, and I talk about Parkinson's disease from a daughter's perspective. Today we're going to clear up a really common point of confusion. What's the difference between Parkinson's disease and Parkinsonism? They sound similar and they are related, but they're not the same thing. So if you or someone you care about has been diagnosed with either of these diseases, this video will help you understand the difference, what symptoms to look out for, which ones are common, how each is diagnosed, and what treatments are available. Make sure that you hit that like button if you learned something new today. I would appreciate that, or even if you just enjoy the topic. Okay, so let's start with Parkinson's disease, often called PD. It's a progressive neurological disorder that primarily affects movement. According to the Parkinson's Foundation, PD occurs when dopamine-producing neurons in the brain start to die off, particularly in an area called the substantia nigra. Dopamine is a chemical messenger that's essential for smooth, controlled movement. When those dopamine levels drop, you start seeing the classic symptoms of Parkinson's, which are tremors, usually starting in one hand and then moving to other extremities, muscle stiffness or rigidity, slowness of movement, which is called bradykinesia, balance problems, changes in posture or facial expressions, and then later on in the disease, non-motor symptoms like depression, sleep problems, urinary problems, anxiety, even cognitive decline can appear. How is Parkinson's diagnosed? Well, there's no single test. A neurologist, or if you're lucky, a movement disorder specialist, will do a clinical exam and evaluate symptoms. They may use brain imaging like a DAT scan to help rule out other issues, but it's mainly based on observation and medical history. Now, what is Parkinsonism? This is where it gets tricky. Parkinsonism is an umbrella term used to describe a group of conditions that cause Parkinson-like symptoms, such as tremor, stiffness, slowness of movement. But not all of them are Parkinson's disease. Think of Parkinsonism as a syndrome, not a single disease. According to the Mayo Clinic and the National Institute of Health, Parkinsonism can include Parkinson's disease itself, atypical Parkinsonian disorders like multiple system atrophy, MSA, progressive supranuclear palsy, PSP, corticobasal degeneration, CBD, secondary Parkinsonism, which is caused by medications, strokes, toxins, or brain injuries. Now, there is a key difference. With atypical Parkinsonism, symptoms often progress faster, and patients may respond poorly or not at all to typical Parkinson's medications like levodopa. So it was interesting when my mom was diagnosed, the way her doctor diagnosed her was starting her on a Parkinson's medication. He said if she didn't notice any difference when she was on the medication, she probably didn't have Parkinson's. I found that an interesting way to diagnose a disease, but that's how he did it. Anyways, okay, moving on here. Here's where the doctors get to work. For Parkinson's disease, diagnosis is mostly clinical. They'll look for asymmetrical symptoms and a good response to levodopa, like I said. And they expect a slow progression. For Parkinsonism, especially atypical types, doctors look for red flags like early balance issues, rapid symptom progression. Sometimes brain scans like MRIs and PET scans can help distinguish between the types. But unfortunately, there's still no definitive blood test or biomarker yet that can give 100% diagnosis during a lifetime. Okay, now let's talk about treatment options. Parkinson's disease treatments are focused on managing symptoms and improving quality of life. These include medications, levodopa and carbidopa, or dopamine agonists, MAOB inhibitors, etc. Physical therapy and deep brain stimulation, DBS, for those motor fluctuations. In contrast, atypical Parkinsonism often doesn't respond well to levodopa. Treatment is more supportive and might include medications to manage specific symptoms, speech and occupational therapy, mobility aids help especially earlier in the disease course. It's important to note, though, that early intervention and a care team approach with a neurologist, a therapist, and a caregiver can make a big difference in both PD and Parkinsonism for the patient. Okay, now, this section is about life expectancy and outlook. I'm not sure I agree with this, but with Parkinson's disease, it's funny. I did a bunch of research on this, trying to get an exact number. Nobody knows, of course, but it ranged everywhere from 4 to 10 years to 10 to 20 years. Some places they predict that a Parkinson's person can even live more than 20 years after diagnosis. So that's fantastic. It is a progressive disease, but for most people, it progresses very slowly. Modern treatments and therapies have really helped improve the quality of life. James Parkinson described this disease over 200 years ago, and we've come a long way since then, but there still is no cure. For atypical Parkinsonism, the prognosis is generally more serious. These conditions progress more quickly, and life expectancy can be shorter. Once again, the number was all over the place, but everywhere between 4 to 10 years after diagnosis, depending on the type. And depending on all the other details, any other comorbidities or any other illnesses that the person has will affect these numbers. And just remember, every person is different, every case is unique. Early diagnosis, good care, and community support can make a huge difference in the quality of life and the length of life for the Parkinson and Parkinsonism patient. So to wrap it up, Parkinson's disease is the most common type of Parkinsonism with specific hallmark symptoms and usually a good response to levodopa. Parkinsonism is a broader term that includes PD and other conditions that mimic it, but with different causes and different outcomes. If you or someone you know is navigating this journey, make sure to see a movement disorder specialist. And if you can't find one, go see a general neurologist and get the right diagnosis. Support groups, therapy, and staying active can all play a major role in the quality of life. If you found this video helpful, please give it a thumbs up and consider subscribing for more of my content on Parkinson's disease. I'd love to hear from you, so drop any questions or comments or experiences down below. I'd love to read them. Thanks for watching. Take care of yourselves and each other.